Hello students, welcome back to my another video, and in today's video we are going to be discussing the gross anatomy of our large intestine. So first video will be covering the cecum and then we'll be covering the other topics. First off, there is the cecum and the appendix, then comes the colon, and there are four portions of the colon: the ascending colon, the transverse colon, the descending colon, and finally the sigmoid colon. And then in the end, the large intestine contains the rectum and the anal canal. Okay. So first of all, we are starting with the cecum. So what is cecum? Cecum is basically a blind sac which forms the first part of our large intestine. It is a blind sac and it forms the first part of the large intestine. So what is the location of our cecum? It is basically located in the right iliac fossa in our pelvis, and it is present above the lateral half of the inguinal ligament. So the inguinal ligament, it is present below the cecum. So above the lateral half of the inguinal ligament is present the cecum. And there is another point, that the width of the cecum is larger than the length. Normally our organs have the length more than the width, but the cecum and there are some other organs in which the width is more greater than the length. I've shown you in the diagram. This is the cecum and this is the ascending colon. So the cecum, its length is less than the width. Okay. Now the next point, what are the relations of our cecum? First of all, the anterior relation. What are the organs which are present on the anterior portion of our cecum? So the coils of the small intestine are present on the anterior portion. They are mainly coils of the ileum. The second thing is the anterior abdominal wall, which is present on the anterior part of the cecum. Then comes the posterior portion. The posterior portion consists of two muscle groups. The first one is the psoas, which consists of psoas major and the psoas minor muscles. Then is the iliacus muscle. Then we have three nerves. First one is the genitofemoral nerve. The second is the femoral nerve, and the third is the lateral cutaneous nerve of the thigh. So from the name we can know that the genitofemoral and the femoral nerve, they are present near the femur, which is a bone of the lower limb. So the femoral nerves and the lateral cutaneous nerve of the thigh are present in the posterior portion of the cecum. Then comes the vessels. In males we have the testicular blood vessels, the arteries and the veins, and then in the females we have the ovarian arteries and the veins. Then finally we have the appendix, which is present on the posterior medial portion of our cecum. So the appendix is present on the posterior part and medially of the cecum. On the superior portion of the cecum we have the ascending colon, as I've shown you in the diagram, that the ascending colon is present on the superior portion of our cecum. The coils of the ileum are present in the medial portion of our cecum. Now we have the blood supply of the cecum. The blood supply, we have the arterial supply, the venous drainage, and the nerve supply. The arterial supply is through the ileocolic artery, which gives cecal branches. So the cecal branches are directly supplying the cecum and they are arising from the ileocolic artery. And then we have the venous drainage. The venous drainage is through the superior mesenteric vein, meaning that the cecum drains to the superior mesenteric vein. Now we have the nerve supply. The nerve supply is sympathetic and parasympathetic. Sympathetic nerve supply is through the T10 to L1 segments of the vertebral column, and then we have the parasympathetic supply, which is through the vagus nerve.